or so. So I thought today I would just start by introducing you to ISPCAN. A lot of times we hear organizations' names, but we don't really know what they do and how we might intersect with them. So I thought I would give you a little brief overview about ISPCAN so that you could maybe think of new ways that you can interact with us or connect with us, and maybe even plan some trainings and webinars with us. We typically work in silos. Most organizations do this. We're so focused on what we're doing that sometimes we don't really realize that collectively our impact is much greater. If we understand what other people are doing, we can connect and amplify the effect of what we do so that it allows us to do so much more in our shared mission. So today our partners are going to be sharing some great tools and resources for you today, and I hope that you'll be able to make the most of them. I think somebody's got their drawing tool on. If you don't mind, just make sure that you are not enabling any of those things. It's, I know, a strange new world we're in with Zoom. Okay, I think I've cleared the drawings. Sorry about that. So this is a little bit about ISPCAN and our composition. Many of you today might be wondering, where is Denver? We put a lot of the time zones relative to Denver, and I know many of you don't know where Denver is in the United States, but it's kind of in the middle here. And our headquarters is based here because this was the founding place for Henry Kemp, who was a pediatrician at the University of Colorado in Denver. And over 40 years ago, he started ISPCAN. And so we have remained here in Denver because of his history and legacy. But our membership is composed of various sectors. We have everyone from education, government, law and police, medicine, country ministries, public health, which is my background, nursing, psychiatry, psychology, social work, and most recently, faith organizations. So it really encompasses anybody and everybody who is interested in child protection and who is working in this field. Our primary composition, most of our members are either in North America and Europe, and mainly in the fields of medicine and psychology and social work. But we're always looking to grow that. We want people to be connected, and we have lots of opportunities through our membership with many different levels and price points for individual memberships and group memberships. But it's a great way to stay connected to this community of learning. What makes ISPCAN different is that we are a unique global organization where we unite people from different disciplines. Typically we see organizations like, the American Academy of Pediatrics or the American Academy of Public Health or the Public Health Association, for example, which only focus on one discipline. ISPCAN is about bringing people together from various disciplines that all work in child protection so that we can really create child-centered approaches and solutions. Protecting child rights is our main focus. Some of the key programs we have are, focused on advancing people's career through opportunities and networking. We have things like working groups on specific topics like data working groups or working groups on child death review. We also host circles of learning in various languages where we bring people together in one region to talk and share and learn from one another. We recently hosted one in Spanish for our members, and they're open to anyone. You don't even have to be an ISPCAN member, but we really want people to connect and share. Another way that we connect people is through our congresses. I think it's probably our most famous program, and we do it really well. We like to bring together people to share research, best practice, and learn from one another so that we're not all starting from ground zero, regardless of what country and what situation you're in. Another major program we have is to advance training and education. We do this through webinars, journal clubs, and some skill-based master classes. Those allow people, regardless of where you live, and postgraduate education is difficult, and when you don't have access to some of those training and resources, but you want to stay current on the latest tools and techniques, we offer those master classes for people. Another key program we have is in the dissemination of research and best practice. So we're again famous, I think, really well known for our journal. Our international journal is really well known, and it's a great space for people to publish their research and best practice. We also put out every 2 years a World Perspectives. This is a guide, a country profiles. This last one that we put out in is our 15th edition, and it had over 65 country profiles, which allows people to see at a country level exactly what is happening in child maltreatment. We also sometimes put on or put together certain special research projects like our Thinking Space project on children who commit violence, where Dr. Rajiv Seth yesterday from our board of directors spoke about this project that he was leading. And those are some unique, interesting projects that help us to think about some cutting edge things that are happening in child maltreatment. ISPCAN also produced a tool called ICAST. It's a data collection tool that is available to our members, and it is one that helps us to also continue to collect data and do the research we need to advance the field of child protection. So this is our journal. Many of you are familiar with it. Our members do receive this journal as part of their membership. The editor-in-chief is Dr. Chris Weckerly out of McGill University in Canada. And it's a really great journal. We have now made everyone has an online subscription of this journal in our effort to become more environmentally friendly. We no longer distribute published copies of this journal. So electronically, you have access to this journal, and we do some special issues as well, which I'm not sure if everyone knows. They also come out, and they're an opportunity for members and partners to also work with us to develop some of these special issues. So if you have an idea on a certain topic, these are some great ones that have come out over this last year, but those are something that we can work on together. If there is a unique focus that we want to bring forward, that's another opportunity for partners and members to contribute to. So just want to focus 1 second on our innovative approach. ISPCAN connects frontline professionals from every region. We really want you to have the tools and resources you need to do your job better, to have culturally appropriate, language-specific programs that are appropriate for low resource environments and high resource environments. But the most important thing is that things be child-centered and multidisciplinary and coordinated in the response. Because we all know this, better outcomes happen for children when people come together, and especially people from different sectors. And this is what we're trying to do by bringing people from all these different backgrounds together. That's where we find the best solutions, and we ensure that the care is coordinated so that children have the best outcomes. This might look familiar to most of you in the sense that I think it applies to most organizations that work in child protection. I think we're all looking to improve public health systems of care ultimately. ISPCAN ensures that by wanting to encourage the better programs of care and prevention go into the hands of the providers. We want to improve data collection in every country and region so that we can understand this problem better and actually find better solutions. By doing this, we actually are igniting entirely new, better global public health systems. We want to promote best practices so that we ensure healthy outcomes for children. And ultimately, with our collective voice, we also want to advocate for change. And most of our organizations and people here today probably can relate to this. How we go about it might be different, but I think this collective goal probably unites all of us. This is a great example of how our legacy programs in congresses affect communities. While we put on a Congress, we're doing a lot more than that. We're ultimately building a legacy in that community. So ISPCAN never goes back to the same city or country to do a Congress. We really like to move our Congress around because we see ourselves as expanding that net of child protection with each event that we do. So in Qatar, we did some amazing programs for youth and did some unique things to raise community awareness. There was an art contest in the schools where children could talk about or draw what child abuse looks like. That art was ultimately displayed at the Congress and at the Sidra Medicine Hospital, but in effect, those children went home and talked to their parents about child abuse and what this was. And, you know, it helped raise awareness from the youth to the family to the community. And that's our ultimate goal. It's not just about educating our professionals and ensuring that you all have the tools you need, but we really want to make that ripple effect even bigger. Our youth forums are also well known, and in that Congress, the youth themselves decided how would they like to express themselves, and they did a filmed play where they enacted a scene from a home depicting emotional abuse, and then they had a social worker talk about, you know, what could have been done differently. At the same time of our congresses, we usually have working groups, and those working groups come together and have a following about, and some common ones that we usually have are around child death review and around child maltreatment data collection. And those two groups come in and they essentially provide technical assistance to that local region, or in this case, Sidra Medicine, and help them to look at their current child death review system, and provide some ideas and examples of best practice that they could share from different regions of the world. Same thing with our child maltreatment data collection working group. They were able to come in and share some different systems of data collection, and that was a benefit to our Sidra Medicine colleagues in Qatar, who learned from them and were able to ask the questions again to get some technical assistance. So our community of learning at ISPCAN involves individual members, people like you, and it also involves country level partners, of which we have almost 40 now in various countries. We have regional hubs of learning on our website, and then we of course have our international partners, like the partners who are helping us today to bring forward this program. So we have many different ways that you can connect and work with us. And we really hope that together we can do more. So as if we didn't have enough to worry about with just taking care of children and child rights and child protection in our normal environment, suddenly in March of 2020, we all were faced with this terrible crisis of COVID, and trying to figure out how do we respond to this? Not only are the children at risk from the other ACEs that we normally worry about, but now they also were trapped at home, vulnerable, in the middle of high stress environments, and many times not even having access to the normal care and providers like the health professionals that they normally get counseling from. It made them more at risk. And I know we were all scrambling to try to figure out how do we handle this? What can we do to really change the way we work? You know, kind of on a dime. We had to readjust, and entire systems of care had to respond to this need. I mean, we all know these numbers. A third of the global population was quarantined. We had school closures. Children were really affected. So starting in March of 2020, ISPCAN's at least response to COVID-19 is we did create an entire page of COVID resources on our website, which is still there. We brought together the resources of many of our partners. We tried to provide parenting tips, telehealth best practice, because this became a new thing of like, how do we do telehealth when, and so we don't lose connection with the children that we need to serve. And then we also put out 2 special issues of our journal that focused on the impact of COVID-19, so that we could try to disseminate what people were doing, what people were learning, what could we share in real time that helped us all to navigate through this new world. So that led us to this moment where we put together our very first World Summit. And our World Summit's entire theme was on facing our post-COVID world with resilience, data, and effective solutions in child protection. This concept note really was about us bringing together individuals and partners so that we could share knowledge, experiences, and best practices in this post-COVID era. We could bridge those gaps build skills and networks between researchers, policymakers, academia, caregivers, civil societies, and practitioners. We really wanted to provide knowledge on the cutting edge research so that we could design evidence-based policies and programs to address this issue. And then, of course, bring forward inspiring actions, mobilize champions, and really try to understand how we can all together now take more actions at the country, regional, and international level moving forward. So, you know, in the end, we really hope that all of us interacting today and yesterday is really going to help us to make our child protection systems a little stronger and be more coordinated in how we work together. You know, our summit came about because we had to cancel our Adelaide Congress, not once, but twice, as we had to first postpone, and then we had to then think, okay, can we do it again? But, you know, we realized that we had an opportunity to do something new and unique. So this is our very first World Summit, and we're really grateful to have you here for this. I would really like to thank the many partners who came together to help us get this World Summit off the ground and bring forward these really interesting workshops and keynote speeches so that we could be inspired and understand where was the need and how do we deal with this COVID that's here to stay, and eventually create more resilient systems of care for children. So I would like to just take a minute to thank We Protect Global Alliance, Arigato International for Children, the Global Partnership to End Violence Against Children, the Alliance for Child Protection and Humanitarian Action, Together for Girls, the Centers for Disease Control, ISOP International, Child Helpline International, the World Health Organization, World Vision, and UNICEF. So we have a great lineup today, and I really want to encourage you all to engage with each of our keynoters, as well as our partners who are putting on these